I have been talking about healthcare, universal healthcare, Medicare for all, single payer healthcare, whatever the hell it is you want to call it. I've been talking about it for years. And the people on the conservative right in this country just, it does not sink in. I'm going to show you a video from my friend Joe from Canada who's going to try to explain it again. My guess is it's still not going to sink in with most of you, but it is pathetic that you guys continue to think that these other countries that enjoy healthcare as a human right through their own tax dollars hate it. That they long for our system. No, they don't. There isn't a fucking country on the planet that longs for our healthcare system.
How's Canada's healthcare working? Well, Jeff, thank you so much for asking that question. I understand you're asking it in comparison to the United States because I tend to take a pretty hard knock at what's going on south of the border. So let's compare the two, shall we? First and foremost, Canada, and this is incredibly important, Jeff, so pay attention, write a couple of notes. Canada is putting nobody into a medical bankruptcy to save their lives or the lives of their loved ones. Do you not think that's a fundamental value of one of the most wealthy nations on the planet, Jeff? Do you not think it makes sense that the government steps in to make sure there's a level of equity with the dispersal and the access to healthcare across your country to make sure at the very least they can walk into a doctor or a hospital and actually get treated? Would you rather this not be a right?
Yeah,
because if this isn't a right, let's say, and you decide to put the $1 trillion or $1.5 trillion, Jeff, into the military as opposed to this, you are choosing your priorities. And those priorities are flawed. And those priorities, I hate to tell you, Jeff, are at the heart of a declining empire. Now, if you're going to say Canada's healthcare is declining, I'm going to agree with you, Jeff. I'm going to agree with you, not because it's not an inherent value of Canadian life, not because it's not important, not because we shouldn't be holding it up with incredible respect, but because conservative governments are actually trying to figure out a way to get out of having that responsibility. So what are they doing, Jeff? They are defunding. They are refusing to expand and put any more money into this situation called healthcare. Why? They want it to break, Jeff. They want it to crumble. And they want it to crumble to abdicate all of their responsibilities so private corporations who are some of their best friends get to reach out their hand and save them from the ashes. And what? Put a bunch of medical bankruptcies on people in Canada?
Profit.
To ensure that trying to get insurance is near impossible. And if you get it, the deductible and the copay alone could crush any middle-class family. Is that what you're after, Jeff? Do you not understand that Canada's downward cycle on this is something most of us are fighting against? Something that most of us understand that as a fundamental underpinning of a democracy, having that right, and I still believe it's a right, Jeff, universal healthcare is still a right. Having that right is the basis of equity in a country. It is the basis of rule of law. It is the basis of democracy. It is the basis of freedom. Because if you don't have your health, Jeff, none of those other things matter. And do you ever wonder, hun, that's why your government has worked so hard to not give it to your people? The wealthiest, most powerful country in the world, and that's what you all say, still refuse this basic right. You shouldn't be looking at Canada thinking, why are we on the downward cycle and comparing us to the United States and upholding that pinnacle? You should be looking at Canada and thinking to yourself, why are they on the downward cycle? How can we help embolden? How can we help raise for our own people in order to ensure the basics of life in these incredibly wealthy nations? You should also be asking yourself, why have they done it? What purpose has it served? Because I'm going to tell you, Jeff, if you can keep a population sick and scared, you're easier to control, hun.
Everything she said is 1,000% true. And this is what I don't understand about the conservative right in this country, because I'm getting ready to show you what we pay for health insurance, or explain to you what we pay for health insurance. And keep in mind that when you're listening to these numbers, this is what the conservative voter in this country votes to keep, not to fix, not to change, not to get better, to keep. The American dream is to work for yourself, right? Renee and I work for ourselves. And as a result, we pay more for our health insurance because we're not part of a group plan that has a shit ton of employees on it. We pay $1,765.67 a month just to have the insurance. We have a medical deductible, each individual within the plan, which would be myself, Renee, our daughter Lily, and our son Tommy. Each individual has a $7,500 deductible, or we have a family deductible of $15,000 that needs to be met before insurance kicks in with a whole bunch of coverage, and a medical out-of-pocket maximum, individual $10,000, family $20,000, and none of that includes the co-payments we pay when we go to see our primary care doctor, the co-pays we pay when we go to see a specialist, the co-payments we pay when we pick up our medication. I have one medication that when I buy it, it's my Skyrizi. It's a 12-week injectable to fight my psoriasis. When I get the first dose of the year, it costs so much money that it causes me to meet my annual deductible like that. When I picked up my Skyrizi in January, my annual deductible as an individual was met. That's how much the shit costs. Renee's got one that costs $1,000 a month. And that doesn't include all the other medications we have. That's the system that the people on the conservative right in this country are fighting to keep. They are fighting tooth and nail to continue to pay more than any other industrialized nation, have worse medical outcomes than any other industrialized nation, and have lower life expectancies than most of the other industrialized nations. That's what they are fighting to keep. So why are they fighting to keep it? Because the people that they vote for on the Republican side of the aisle have convinced them that if they go with the same system that every other industrialized nation uses and that works for them, and it causes their citizens to spend less and have better outcomes, if they go with that system, they have been convinced that there's going to be some death panel of politicians somewhere that's going to deny them their coverage, while they walk into a hospital and get denied coverage from the very health insurance that they pay every month to have. It is one of the most mind-blowing examples of political conditioning I have ever seen in my life. Republicans, conservatives, MAGAs, they consistently vote against their own best interests when it comes to healthcare because the messaging from the right is that effective.